name is Dr. G. Ravichandran, a senior consultant dermatologist practicing in Apollo Group of Hospital, Chennai. Today we will be discussing something about a very interesting disease called psoriasis. Psoriasis is very commonly seen across India, across all over the world. It's characterized by silvery, scaly, erythematous red patches which is seen commonly over elbows, knees and also over the scalp. It has got a period of exacerbation and remission. There are factors which can trigger and perpetuate psoriasis. It can also be transmitted through genetic inheritance. It is commonly exacerbated following cold climate and also any kind of respiratory infections and emotional stress. Psoriasis is now of late becoming an inflammatory disease of a lifestyle disease. So it can also be related to other conditions like comorbid conditions like diabetes, obesity, hyperlipidemia, and the most important factor which we need to address today is chronic psoriasis is generally associated with coronary artery disease called the heart disease. So one has to be very careful in identifying this inflammatory disease at the early time so that we can definitely give very good options and treatment so that there is complete clearance of skin lesions in these individuals. How does it appear? It appears as scaly, red, white peeling of skin over the elbows, knees, scalp and other parts of the body. It can also be affected by arthritis. Patients can develop joint pains and it can cause a crippling arthritis at a later date if you don't treat them at the early stages. So what are the methods by which we identify this disease? We can do a skin biopsy to confirm the diagnosis before we initiate management. What are the management? We have topical treatment as well as systemic treatment. What are the topical treatments? We give emollients, topical steroids with salicylic acids. And then we have the oral agents. We have the time-tested methotrexate, cyclosporine, oral retinoids, and of late the recent advances have happened across the world and too in India that we use new options called biologic treatment. Biologics are very important and very effective and very safe, and we have a screening method to identify before we start these patients on biologic treatment. And we have a few molecules are available in India. It can be taken as a subcutaneous injection. We always choose these agents for second line management if the patient has not responded to the first line treatment. Psoriasis is curable in the sense that it can remain lifetime, but one can have a clear free skin without psoriatic lesions. So the quality of life and the personal lifestyle can definitely improve in these patients, because psoriasis is a disease wherein it can affect not only the individuals but the people around them, so that there's a loss of work also can be associated with that. So it causes psychological depression. So we need to address this in a clear way. So you have to approach to a good experienced dermatologist to treat these conditions well.